Guys, welcome back to my channel. If you're seeing me for the first time, my name is Joy. I am your private nurse. So in today's video, we are going to be talking about cutting and dissecting instruments. So cutting instruments have sharp edges. They are used to dissect, incise, separate, or excise tissue. Most instrument sets include knife handles, blade, scissors, curved mayo, tenotomy, dressing forceps. The function of this instrument is to divide tissue, suture, bandage, etc. So we are going to see more of that in this video. So cutting and dissecting instruments, these instruments basically are precisely designed and manufactured to. They can be used for single and both multiple use, but I've not really seen when they use it for just single use. They do use it for multiple use, okay, and they sterilize. They keep it clean by sterilizing. So guys, for this reason, most of them are made of high quality stainless steel, chromium and vanadium alloy to ensure the durability and the durability of the edges and basically resistance to corrosion. The first instrument here is our scissors. So blades of scissors may be straight, angled or curved. It may be a straight blade, a curved blade or so. Tips may be pointed or blunt. Handles may be long or short. Scissors should be used only for their intended purpose, which is cutting, okay? So we also have suture removal scissors and also episiotomy scissors or bandage scissors. So the suture removal scissors, we are going to look at it in another view, but the episiotomy scissors is used for during surgical procedures like vaginal delivery, assisted vaginal delivery. It can be used to cut a part of the perineum so that the baby will be able to come out easily from the pelvis of the mother. So this is a curved scissors and both blade tip are blunt and can be curved or straight, okay? The function is to cut suture material, make episiotomy. It's also used to cut tissue during surgery, to cut bandage or gauze piece. So method of sterilization, you can wash, soak in antiseptic solution and then boil in, the sterilizer. But I've not really seen boiling, but I've seen autoclaving. So we also have umbilical cord scissors, and from the name you could already tell that it is used to cut the umbilical cord after the birth of the baby. So the next on our list are orthopedic instruments. This instrument is just for another video, but let me briefly say what they are used for. They are used for treating orthopedic disorder, musculoskeletal problem, and injuries. Okay, so we have handle and detachable blade. So for the bow packer handle, this handle is called bad packer handle. So they are used alongside with surgical blade for tissue separation and other procedure that require a sharp surgical blade to puncture or cut. Okay, so surgical blades on its own are used. They are just blades that are used for making skin incision, tissue dissection, and a variety of surgical approaches. It can be used for other things during the surgery. So the blade is detachable from the handle, which is the bow packer handle. So dissecting instruments are type of forceps that are used during surgeries also for dressing and picking up pieces of sterile items such as gauze, suture, surgical blade, as well as to hold tissue and to clamp vessels and organs. Okay, that be a straight or a curved dissecting forceps. It can also be a toothed or non-toothed dissecting forceps. So here we have a non-toothed dissecting forceps. This type of forceps are used to grasp soft tissue. It could be curved or straight. They are made up of metals and they can be sterilized after use. Okay. Forceps should be held like a pencil. It should not be held in the palm, okay? It shouldn't be held in the palm, it should be held like a pencil. So the next item is hemostatic instruments. Hemostatic instruments are just those instruments like forceps and all of that that are used during surgical procedure to clamp the skin, tissue, or the end of vessel to stop or control blood flow before they are being tied, okay? Artery forceps are also, part of this hemostatic instrument. So this is a straight artery forceps and they are primarily designed to control bleeding during surgical procedure. It is used by clamping off the blood vessel. They can also be used for temporary occlusion, assisting in suturing, and tissue grafting. We also have the curved artery forceps. So the difference is that this curved artery forceps can clamp artery and tissue in those hard to get areas, all those hard to reach areas like deep body cavity. The curved jaw provide better visibility and control. Needle holding forceps are used to hold a suturing needle during surgical procedure. So we've talked about non-toothed forceps. So let's talk about toothed forceps. Toothed forceps can either be curved or straight. They are mostly used to grab tough tissue and to rupture membrane. They are reusable and are sterilized before use by washing, autoclaving them, and are sometimes soaked in antiseptic solution. So these toothed instruments includes toothed straight Kocher forceps. So this is a Kocher forceps. This is an Alice forceps. So Alice forceps are toothed. They are used to grab tough tissue as well as to rupture membrane. Okay, you can see the tip. So this is a Babcock forceps. Okay, and Babcock forceps are finger ring non-perforating forceps used to grab delicate tissue. They are frequently used with intestinal and laparotomy procedure. Babcock forceps are similar to Alice forceps. So guys, we also have sponge holding forceps. It is used to clean areas to be operated on, as well as used to carry out procedure like perineal care, and occasionally it can be used to clamp. Okay, guys, you could see the circle on the sponge holding forceps and also the lines that are across. These lines are called groove. Anyway, you see these lines with forceps and instruments, they are called grooves. So guys, this is a transfer forceps. It's used for sterile transfer of forceps. It can be used to arrange items on sterile tray and to transfer items to sterile field. Okay. So guys, this is a straight artery forceps and they are primarily designed, like I said, to control bleeding clamp blood vessel and all of that. So you could see these lines again on the forceps. Like I said, these lines are called groove, okay? They are called groove. And sometimes you could see depression in it. You could see some, bends and holes, kind of. So those holes are called depression. This is a curved mosquito hemostat. It is used to hold delicate tissue, used to compress bleeding vessels. Jaws are fully aerated. Okay, so mosquito um forceps, they are used in microsurgical procedures. They are also used to obstruct blood flow in smaller blood vessels with minimal damage. They are also ideal to use for delicate tissues also. This is a hook retractor. They have flat end at one side, and the flat end is blunt, is a blunt retractor. They also have three prong end that may be sharp and it may be dull. So they are used to retract small incision or secure a skin edge for suturing. Okay, so guys, this is an ear cure, is it curette or current? So it can have a sharp or blunt scraper end used to remove earwax from the ear canal. And then this is a nasal speculum. It is used to spread nose reels during examination. It can be used to spread the nose. It can be opened and then closed also. This is a vaginal speculum. It is used during gynecological examination or procedure. It facilitates access for observation and treatment, and it can, dilate the opening of the vaginal cavity, allowing for inspection of the vagina and the cervix also. So this is an amputation knife. From the name amputation, it is used to amputate, cut out a part of the body. As you can see, it is longer than a surgical blade, and the handle is different from a Bowpacker handle also. Okay, so it is used to cut out a part of the body, maybe due to cut of blood supply or something. So these are gauze, dry and moist gauze. So this is a towel holding clamp, and a towel holding clamp is used in all surgical procedures to hold tissue. It is used to hold towels, and also it is used to hold drape. They can also be used to hold cables, suction lines, and some power equipment cable during surgery. So guys, lastly, this is a stitch removal scissors. It is used to remove sutures. Blade has beak or hook to slide under the suture, so you can see the beak or hook that you slide under the suture before cutting. All right, so guys, I hope this video was helpful. I hope I was detailed enough. I hope you understand this video. Make sure to share this video, like the video, so that other people can also see it. Okay, thank you so much for watching. Bye guys.